Now let's talk about CGM, continuous glucose monitors. These are some of the most amazing tools for patients with diabetes, and when possible, they should be utilized for patients with type 2 diabetes. CGMs are continuous glucose monitoring systems that deliver real-time data to patients that help them understand how their lifestyle interventions and their medications are changing their blood sugar. Real-time feedback is positive reinforcement for good behaviors and negative reinforcement for bad. These tools are so helpful in the management of type 2 diabetes. We have two types. One, flash glucose monitors. These are monitors that can be inserted in the skin, and then the patient swipes over the sensor with their phone or a reader, and it tells them their blood sugar in real time. So long as the patient swipes about every 8 hours, they will have a complete readout for you to look at of what their blood sugars are over a 24-hour period of time. These systems tend to be less expensive and are actually quite affordable for most patients. We also have continuous glucose monitoring systems that continuously monitor a patient's sugar regardless of whether they're swiping or not. These read the blood sugar every 5 minutes and give the patients real-time data about their blood sugar. These devices have taken diabetes management to the next level and should be used wherever you can.
CGM is so helpful for us and even more helpful to patients. It minimizes the need for finger sticks and thus improves compliance with checking blood sugar. A more informed patient is a more empowered and engaged one. They also serve as a wearable accountability device. Good readings reinforce good behavior. This is a report from the most commonly used flash glucose sensor. This is the first page of the report, the AGP report, or Ambulatory Glucose Profile. At the top, you'll see the dates of the readings. You'll see how often the patient is using the CGM. Below that, you'll see the patient's average glucose. Here it's 147. Below that, you'll see the Glucose Management Indicator, or GMI. This is representative of what the patient's A1C would be if they were to have similar blood sugars over a period of 3 months. They can't call it the A1C because an A1C is a measurement of 3-month glycosylated hemoglobin, and this uses interstitial fluid. Next to this, we have this bar. The yellow part indicates when the patient's sugars are high. Here you'll see this patient has high blood sugars 21% of the time. The green is when the patient is in range. Here you'll see this patient is in range 76% of the time. And low represents when the patient is low. This patient was low 3% of the time. Here you can see their patterns from day to day. The broken lines are when the patient wasn't checking frequently enough. This device requires that the patient swipes over the sensor with either their phone or their reader at least once every 8 hours. If they don't do so, the line breaks. So I recommend that my patients swipe right before they go to bed, right when they wake up, and at least 3 times during the day, usually at meal times. The daily log comes later in the report and is also very helpful. This is a day-to-day graph of blood sugars. Here you'll see that the patient's blood sugar was stable overnight. This is when they actually swiped, and it gives you their specific blood sugar below. The circles represent when they checked. Here you see that the patient did not swipe within that 8-hour window, thus we have a large break in the graph. You can see how the patient's blood sugar increases somewhat after a meal and then comes down nicely. You can see that the patient ate late here and the blood sugar spiked overnight, but then again came down nicely. Patterns are really helpful when understanding blood sugar. Finger sticks are just snapshots in time. Understanding the big picture really helps us in our management and moreover helps patients understand how their lifestyle impacts their blood sugar and reinforces good behavior. This is a report from the most commonly used continuous glucose monitor. This device does not require the patient to swipe over the sensor. It automatically records blood sugar every 5 minutes and displays it for the patient. You'll see similar information as the previous CGM. Average glucose is at the top left. Below it is GMI or estimated A1C. We have a bar here where yellow tells us the amount of time they were high. Green tells us the time they were in range. Here it's 46%. And red tells us when they were low. This report also gives a daily report. Here you can see this patient's daily trends. Patients can put information about capillary blood sugars, meals, insulin given, and activity that can further help us and them understand patterns.